Hey friends, if you are wondering the many ways that you can take care of your joints, particularly the knee, as you prepare for the next stage in your life, and you want things simplified into a visual term that you can understand, that's what we're going to talk about in this video. I'm dressed up to try and picture being at the beach, kind of, sort of. And yeah, we're going to talk about how the knee actually moves and why it's important, why it can be very helpful to visualize things like I'm doing. And I'll give you some practical exercises that I do to take care of my knee, and maybe you'll get a couple ideas in there that just might help you. Okay? So without further ado, let's get started. All right, so I want you to imagine that in your knee, you've got this very important piece of tissue called the meniscus. It's like a shock absorber, okay? But I want you to picture it like it is an inner tube floating on the water. I've got the sound of water in the background. And as you're moving your knee with me here in sitting or in standing, we're getting a chance for our joints to warm up. And this is important because can you imagine how that inner tube would feel if it was being pulled across the gravel, being pulled behind a truck, for example? How long would that little inner tube, that shock absorber, last? And then imagine if that inner tube was always in contact with water and could move fluidly, how much longer that inner tube would last. So the first takeaway that I have to share with you is that if you're going to ask your knee's shock absorber to do its work, it's really important that you give it the fluid it needs to move freely. Every time you bend your knee, you're creating a little bit of space in there for the natural fluid that our body makes to come into that space and provide basically the lubrication so that it can actually move. And that's why it is important to do a warm-up before you go ahead and ask that knee to do its job, to load, okay? So there you go. I don't think you'll forget now how important a warm-up is, because you'll remember what riding on an inner tube on gravel would do to your tube over time, right? Excellent. Let's move on. Now, the shock absorber in your knee, the meniscus, it is there to act like that inner tube. Imagine if you were riding on an inner tube behind a boat. That tube is going to deform depending on what pressures you put on it, especially if it's not inflated maximally. It is fluid. Certain parts of it can kind of close down, opening up the space at the back. It can deform side to side. And so if it's well lubricated and you've done a warm up and it's healthy, then it's going to do that. It's going to deform, it's going to shift around, just like if you were sitting on an inner tube being pulled behind a boat. However, if it's dry, if it's not able to slide, roll, deform, that's when you end up with having these, the end of our long bone here, the femur, that's when it ends up catching, pinching, tearing. And maybe you already have noticed that you're having moments where you don't quite have that shock absorber that you need. So motion is lotion, seriously. And the timing of it, getting that movement at the beginning, getting our bodies prepared for the the ride that we're gonna take on the meniscus, that is very important. All right, what's my other points? I made notes because there's a lot of content here. I'm expecting this video could be at least 10 minutes, might even be 20. And what I'm gonna do after this is I'm gonna break it up into key takeaways, and I'm gonna put those takeaways in my group, Discover Movement. That way, the folks who really wanna take these lessons and get exactly what they need can go, get the insight that they need, apply it, come back to it, and they don't have to watch 20 minutes of video every time. So I do have a plan to take these insights and bring them to you, but it's going to be within a group. I think this week I'll put it in Discover Movement, and we'll see. So if you want to just catch the chunks and have them tagged with the key points, I just covered movement and warm-up, for example, then I'll drop the link to the group and you can go ahead and join. Well, now what's the next thing I want to say? Give me a minute. Oh yeah, your knee. Your knee is as beautiful as a shell, and it moves in that way. Oh no, I want to get to this point first. Your kneecap. All right, so coming back to this image of a floating bone, your kneecap is like that. It's a floating bone, and when you can relax your leg, like sitting on the floor, and it's got just a little bit of give, you'll notice it does wiggle around. So you've got a bunch of moving parts, and at the end of the video, I'm going to tell you things you can do to help this kneecap get the perfect or optimal, better alignment as it's moving. There's a method behind my madness, you guys. There's a reason why I'm dressed up for the beach today, and it's because I know it's hard to learn new information, and if I can give you a visual, if I can have you imagine being at that beach on that inner tube, then you don't have to remember all the teeny tiny details. It's about efficiency. It's about having something meaningful. It's gonna follow you in your day so that next time you go to use your knee, you're not gonna have to remember everything I said. It's just gonna be, it's gonna make so much sense to you. You just do it, right? So that's why I'm creating visuals. That's why I'm describing movement like things that we already know and understand from day-to-day life. Our knees, they have a center point. It's called an axis of rotation, okay? It's basically like the pivot point for the movement. And one misconception that you may have heard is this idea of when you're doing a lunge or a squat, you want to keep your knee over your second toe. That's partially right, but it's only partially right because that is just one snapshot in time. That is mid-range when you want to have your knee over your toe. It turns out that when you are actually moving through range, you're putting your knee into flexion and extensions, bending and straightening, your ankles bending and straightening. It's got a lot more dynamic center that it's rotating upon. Kind of looks a little bit more like a shell if you were to take the bottom of my kneecap. As I straighten, the knee is actually rotating a little bit, and as I bend, there's some twisting that's happening naturally. So you can try and think to keep your knee over your second toe, but that's not actually how the knee's meant to move, and it might look good to an observer to see, oh, look, she can keep her knee right over her second toe as she's doing her lunge. But actually inside the body, it's not as efficient. It's a lot more work. And so these ideas, if you imagine your knee as a shell, and you imagine that axis of rotation is like the coils around the shell, then you'll respect and understand that as you're doing that movement, it's probably not a straight line. There's probably, you're noticing a little bit of a twist. You're probably noticing a little bit of a drift, and that's okay. What do you really need to focus on? We'll get to that. We'll get to that. Just for now, follow me and imagine you have an intricate design that is actually allowing more freedom of movement than one fixed line, okay? You can't just draw a line and say that's how optimal alignment should be when you're doing lunges, when you're doing squats, those kinds of things. And that's why when you go into a squat, when you go into a lunge, it's not going to be completely even pressure on your meniscus. There's going to be maybe a little more weight bearing on one side, which means you're going to close down a little bit on one part of the meniscus. The other part of the meniscus is going to open up, and you want that. You want the kind of meniscus, the kind of shock absorber that can go with the flow, that can move as you ask it to move. It's like you're on that tube being pulled behind the boat. When you're being pulled behind a boat, you're not going to just stay in one place. You're going to drift depending on where the boat goes. And this is what happens essentially, the visual that I want you to imagine. As you're doing a knee bend, an ankle bend, okay? What's happening is the more you go into the bend, you're getting an outward rotation here and here. And you've got the opposite happening in the middle. You've got that outward drift, okay? So think of this. If you're riding behind a tube and your line goes slack, because you're getting a little slack, right? You're not locked in, you're loosening up a little bit. The boat just turned. And you're about to swing, the tube's about to swing to the outside, right? Get yourself ready for the turn. This is what's happening. And this is what's happening in our knee joint. As we go to bend down, the swing that naturally wants to happen is you want to have a little bit of rotation here. And oftentimes our body tries to do a little bit too much. That's when we run into problems with our kneecap kind of getting out of the groove. And isn't that a lot like riding a tube? When you swing too far, the boat turns, you swing out to the side, now you're on rough water, you're not following the path of the boat anymore, you're not in the groove, right? So essentially, a lot of work that I'm doing in physio with knee pain is about trying to allow that knee to stay in the track as the line goes slack, not letting things get too tight, too weak, where it swings too much. So a lot of folks are trying to stretch here and have a little more action in the inner part of the quads as they bend, so that they can have a little bit of a check rein from that big swing that's going to take the kneecap out of alignment. Make sense? A couple ways we can do this. Well, let's start with squats. This might not be the ideal thing, but I'm kind of just winging it. I got a football here, okay? So if you're working on getting control with your knees bent, here's an example. I want you to have a little something between your knees to squeeze so that as you go up, if you're just learning this, you're engaging a little extra support in the inside to keep things from swinging a little bit too much on the outside, okay? So you can do that this way. You can take it to the wall. What I like to do at the wall is not sit like this straight. I like to actually get my bum back like this against the wall, okay? If I'm doing a squat, it looks more like pretending that I'm gonna sit down in a chair and my butt's against the wall that way, okay? It's not like this, because that's not very efficient actually. In day-to-day life, when we get down, we're probably getting down to somewhere and it looks a lot more like that. So do that against the wall with your chest up. If you're gonna do the squats against the wall, get something between your knees. I probably, if I was more prepared, would have chosen something a little bit wider for my own comfort, because I feel like I don't really have my knees directly below my shoulders well. I've kind of got a little bit of this movement here, so, and this is too much and awkward, so just find something, roll up a towel or something, and you get my drift. Keep a little bit of a squeeze as you're coming down. I would rather have movement with control than worry about how far I get down, because as we get down further, we are having a lot more contact between the kneecap and the bottom of our femur, and so that is compression. It's a real force, and some knees just aren't ready for that. So it's perfectly okay to be working on something like this. And we can think about kind of, I guess, water skiing. We're doing a lot of water skiing positions here. There's a way to do it with bands as well, and I suppose if you really want to do it that way, you could, right? Like, you could change it up and stick a band here attached to something, and as you're doing your knee bend, then you've got something to work against. That's very helpful if you're doing something like a lunge, right? Let's see if I can back up this a little bit so you can see me better. All right. It was really neat to watch my daughter in the yard this morning. She's 2 and she wants to take on the scooter. And you know what she did? She showed me a very simple thing. All right, so you're at the beach and you're watching people go by, and some of them are on scooters. Where do you think their shoulders are? You think they're riding the scooter with their shoulders way over here? No, if the scooter's here, they're gonna have their hands here, they're gonna have their shoulders here, right? They're like a triangle, right? So the first thing I do when I'm doing a lunge is I position myself on that scooter, because if I think about being on a scooter, I'm not gonna fall off. If I don't think about being on a scooter, my shoulders could be anywhere because it doesn't really matter. I've got this balance point here anyway, right? But if we're thinking about alignment, imagine you are on a scooter, and then you'll be a lot more conscious of where your shoulders are, over top of your hip, over top of your knee. Generally speaking, just try and make a nice triangle there. But forgive yourself if you find that you aren't really making a completely straight line when it comes to where this knee is going. You can give it a little bit of encouragement by giving it something to push against, but I think it's okay to allow a little bit of freedom of movement, because it might actually be infinite design, and maybe you're not designed to move, like I said, perfectly on a line. Focus on getting that triangle. Focus on, generally speaking, in the middle of your movement, you want to hit the knee being over the second toe. But that little bit of drift on either edge is part of how the knee actually moves. The other thing about squats that I think, lunges that I think is worth mentioning is that lunges are kind of more helpful when they're wide. It's a wide step. That's so that the knee isn't really getting into too much flexion and is giving you more discomfort than you really need to do the exercise. So I get wide, and I imagine like picking up a shell or something, and I don't worry so much about how far I'm getting down. It's more about having a wide leg and having this control and alignment, right? You do want most of the weight over the front leg, because it's really the thing that's taking the most weight. And look at that, when I don't think about it, I'm like way over there. That's not going to do me any good whatsoever. So what I do is get the triangle, get over the second toe, and then allow a little bit of wiggle room right there. Here's how you do it in sitting. sitting, put your leg out to the side. Here's your weight-bearing leg. Make your triangle. This leg's just basically like a counterbalance. So I like having it kind of out of the way so that I can really get my hand down and imagine picking up that shell. This is just an extra little balance touch point. So whatever feels good for you, getting the shoulders over the knee, making that little triangle, same idea, just doing it in sitting. Does that make sense? If anyone's watching and has a question, throw it out there. I might jump to it right then, or I might think about it for a little while and then respond back to you. Also, if you're here and watching, I always love when people say hi, so I don't feel like I'm kind of alone in all this. What do we have to talk about next? Kneecap. All right, kneecap alignment. So I probably would do this in bed, because if you try and wiggle your kneecap, you've got too much muscle kind of working on this at the same time. So if you're finding that there's grinding or a discomfort right underneath your knee, aching and burning, then perhaps it is true that your kneecap tends to swing, and maybe you are in that scenario where it swings outward, gets out of its groove, and feels like it's kind of on rough waters. So there's a few things that we do. You're already targeting it by getting this knee control, either by thinking about your alignment or using a band, using a ball. A couple other things you can do though is to stretch the outer hip. So you just get a little bit of weight on it and then you lean away from it. I should be maybe against the wall here. You basically just get a little bit of weight on it, get it right under you. So if you can bring it towards the wall, that's good. And then you lean out of it. So it looks like this. Get it under you, like under you as much as you can. And then you lean out of it. And you feel a little bit of a stretch there, right? Stretching these tissues here that do pull the kneecap out to the side. Stretch for 30 seconds for sure. Stretch for 2 minutes if it feels good. Your knee's got to be straight for this. And yeah, you might find you get more of a release with 2 minutes. So if you need to take time, take time. Another thing people do if they're really not getting enough of a stretch with the standing stretches is they'll like roll over something, right? So you just lay on something, get it right up close to the hip. Probably wouldn't be a football, it'd probably be like a pool noodle or something, but I improvise. And just roll your body weight. If you need a little bit more movement, that's good. And if you want even more, a press up. Better make sure I stay in this. A press up out of it, lean away from that position, and you'll get even more of a stretch. So I'm pressing up there and getting out of that. Getting a little extra. That's a very localized stretch. You're taking it and the pressure is actually lengthening right at that spot, stimulating your stretch reflex, telling your brain, she's asking me to do something. She really wants me to stretch. I guess I better let go. And eventually your brain says, oh, okay, fine, I'll do that. So that's how to stretch. Or to stretch it near the kneecap, you get a little bit of relaxation for the knee. So it's got a little bit of give. This might be too much. Yeah, it should be like a pillow or something. Something little and soft. And you just pay attention to whether or not you can make this teeny tiny little floating bone. Think of it like this little tube floating on the water. you've got to get just a little bit. Oh, see, that's much better. Okay, I had too much of a bend there. It's got to be like the teeniest little slack. All right, for now, I'll just stick my hand under. I needed something really small. And then I can feel, oh, there's that wiggle room. Some people think that's really a gross feeling, but for me, it's kind of interesting. And then basically, at the knee, it already wants to swing out, so you're going to be redirecting it inward, doing a little stretch right there. Same idea. You can hold it for 30 seconds. You can hold it for 2 minutes if you're getting more of a release after 30 seconds. I had this professor in university. He used to dress up for all of his lectures. And I found that that was really helpful because when I was trying to remember it in my memory later, I had a few different reference points to come back to, right? So that's why I'm a little bit crazy with how I'm presenting ideas to you guys. It's in hopes that you're going to remember the main pieces and be able to carry them with you and help them in your day. I hope some of these visuals helped you. We went over thinking about your knee like a tube needs water. It needs to have a little bit of control so it doesn't swing out there and get into rough water. So giving your attention on keeping that tube behind the boat as you go slack, as you go to bend your knee, is really what I focus on when I'm doing any movement. So I'm thinking about it when I do my lunges. I'm thinking about it when I do my squats. I'm thinking about it when I stand on one leg. Before I go to lift a leg, I'm thinking, okay, get my triangle, get my knee over my toe in the midpoint, and then I'm holding that in my mind's eye. This is where all my attention is. A little bit of freedom, a little bit of movement. Doesn't matter what I do. If I'm bending more, basically I'm keeping this in my focal point and saying, okay, it's a shell. It's got a little bit of movement. Allow a little bit of freedom with a lot of control, and you'll be getting everything you need from your exercises. It's really about how you do them. Your brain learns, your body learns this stuff faster than you think. So if you can just keep focusing on your practice, you'll probably surprise yourself at how quickly you can catch on to some of these things. I hope that was helpful. Let me know if you have any questions. I'm here for you. Thank you for watching.